Poor Americans, poor Americans. Do you know why? Do you know why they are poor in my eyes?
I could guess, but I prefer not to.
It's the healthcare. And you're gonna talk about it. It's a hard subject.
Yeah.
I know it.
Yeah.
But I would like you to explain me the healthcare of the USA. Please do.
I'll see.
Please try.
I will try. All right, so you've heard about American healthcare systems because
Everybody say it's bad.
Yeah. So first, before I try to explain a few things, and I'm not a specialist, I tried to do some research, but if you're interested in this topic, find one of the great videos that specialize in this topic because it's very, very complex. But let me react to a few things about how you see American health. What have you heard? Mm-hmm. How do you picture American healthcare system? How do you see the situation?
How do I see it? Well, I heard it's the worst. You have to pay a lot of money, and if you are really, really ill, you will not get the treatment because the hospital will try to make you not being covered by the insurance. The insurance company would be hunting you.
Okay.
And
this does all sound very post-apocalyptic. It's true. I think some...
But I think you will get only some basic treatment for free. I don't know if it's free. Maybe not even that. And
Never
then
free.
You have to pay for even taking a handle to go to your doctor.
Just opening the door.
Yeah, just opening the door would cost $50.
Okay.
So I've heard it's a lot of expensive, and it might be good quality, but probably not many people would be able to allow it.
Okay. So a few of these things that you mentioned are definitely exaggerations of the situation. Like, if I understood you correctly, saying the hospital will try to get you uninsured or something like this?
Well, I think the insurance will try to
not cover you.
Not cover you. So
yes.
You have to pay for the...
You pay for the insurance,
yeah.
if you can afford the insurance, and then the insurance will tell you what you can and cannot use the insurance for.
Yeah, so it's tricky. It's not
is
just one insurance for everybody, right? And
no.
It doesn't take care of everything.
No, there are different private insurance companies.
And do you know how many? Is it 5 or 50?
I don't know. It's becoming smaller because they are combining and becoming more conglomerated. I heard recently, the number of insurance providers is getting smaller. Therefore, the competition is going down.
Okay.
Therefore, they control the prices.
So only the big ones.
I think you can find some small ones, but it would be pretty risky, and there's essentially a choice of a few options. I'm not going to try to guess the exact number, but it's not many. The government does actually insure people after the age of 65. So
it's for free after the age of 65.
Right. Still,
and
I
for
think...
for the small children?
No.
No. Okay.
After it's called Medicare.
Mm-hmm.
So this would be after 65, and then you're covered. Still, you have to pay some things. It's much better, and you're covered by the government. You don't just get whatever you need for free, though. It's a bit more complicated than this.
But you don't pay anything by month when you're over 65.
Right. This is my understanding. Okay. Yeah. So the first problem is that a lot of people can't afford insurance at all.
So how expensive would that be, in a month or
in
a year?
It really depends on what kind of insurance you're getting, how good a quality it is.
So what would be the basic one?
It's been a while since I was in the US, but I'm at least...
Just
I'm thinking at least $100, $150 a month. And that might be the minimum, really. And the thing is, then once you
In
have
Czech Republic,
insurance,
there will be like $100 or about that, and it will cover everything
per month, you think?
per month. Yeah.
Okay, right. The
So
problem,
$100 doesn't mean that much, but if it doesn't cover everything, you'll probably tell us.
the problem is if you have like the minimum, still you have to pay for a certain amount of services and treatment before the insurance will start paying. So the less you pay per month, the higher your deductible will be before the insurance kicks in. So you might pay a low amount per month, like a couple $100 a month, but you're just insuring yourself against a big accident of like if you have an accident or have a disease, it's going to cost like $100,000. Then it's worth it. But when you go to the doctor and you need something that's going to cost a few hundred or maybe even a few $1,000s, you still have to pay that even though you have insurance because your insurance starts at a high level. If you're paying more per month, then the insurance will cover more. But from the very beginning, a lot of people just can't afford to have insurance, which means if they go to the hospital can refuse to treat them at all.
If they're like
If they don't have
health
insurance.
plan is not
If they don't
enough,
have
or
insurance at
if
all.
they don't have it.
If they don't have insurance at all. It means they have to prove that they can pay it in
And
cash,
if
basically.
they have a basic one, they might not get treated too if it's out of the
You have to
plan.
ask permission from the insurance company for them to agree to pay for certain things, for certain treatments. They can tell you which hospitals you're allowed to go to, which doctors you're allowed to see, what drugs you can take, etc.
Well, you can do it when you can walk, but when it's serious injury, it could be really difficult.
And there are stories of people who got in a car accident and got put in an ambulance, unconscious, taken to the hospital, and this ambulance ride might cost a couple
Probably
$1,000.
the nearest hospital.
Right, because it's an emergency.
Yeah.
And then the insurance company might say that ambulance ride was not pre-approved, therefore the insurance will
Because
not.
it was not, because he was unconscious.
Yes, it makes no sense. So I'm not going to try to make this system seem logical. Almost no one thinks that the American health system is a good one. Everyone wants to make it better or improve it. But then there's two camps, essentially.
Okay.
Well, there used to be three camps. There were people who thought, well, it's not great, but it's the best we have, not really thinking much about it. There's the people who want like health care for everyone and who want to find a plan like in most European countries, like most developed Asian countries, that the government or some big system is covering everyone together. And that if you get sick or if you get hurt, you'll be covered because you're a citizen of that country. So there are more and more people. Until recently, I would say 2 or 3 years ago, there were not that many people pushing for that plan because it didn't seem to fit the American system. And the reason why it didn't seem to fit the American system is the position of the other side who say that, yeah, it would be great if everyone could have health care and health insurance, but we can't afford it. And if the government was the one doing it, that would be socialism. And we are not socialists, we are capitalists. So it's an ideological thing.
So it could be done, but it's not the American style.
It depends on your perspective, because the people who say that we can't afford it, from one perspective, they're not wrong. Because right now
Well, it depends where you put the money. If you put too much into army, then you cannot afford other things.
Not only that, it's because the health system that we have is one of the most expensive in the world. We spend more on healthcare and hospitals than anyone
Any other
else
country. Okay.
because the system is for profit. The hospitals, the doctors are making a big profit. The hospitals are making profit. The drug companies are making a huge profit. The insurance companies are making a huge profit. Everyone wants to profit from it, and therefore the prices go up as high as they can, as high as people are willing to buy it, which works for a product like a rubber duck or a crystal vase. But when it's healthcare and it's cancer treatments, the price that people are willing to pay against their lives is going to be limitless. People are ready to go bankrupt, and people go bankrupt every day in the U.S. because they get a disease. Yeah, they lose everything. They lose their house. They lose their car.
So
they can't get loans.
So why is not the disease in the healthcare plan? Why they have a bad healthcare plan?
These are people maybe who don't have insurance at all, or have bad insurance plan, have poor insurance plans, or it happens often that the insurance companies just say, no, we don't agree that that's necessary.
Okay.
When the doctor says it is, every situation is different, but it gets very, very messy very quickly. No one likes their insurance company. I heard a podcast the other day of someone talking about American healthcare and saying, no one in America is a fan of their health insurance company. No one has a tattoo of their insurance company saying, I love my insurance company. They did this and this and this. No.
Well, I never heard it in the world that anybody would ever.
It's true, but you should, because in Europe, the coverage that you have and the fact that you don't have to worry about if you'll be able to afford your health care is an incredible privilege for Americans. Like when Americans go abroad, this is one of the most amazing things. If you think that you're sick, you go to a doctor. If you have a terrible disease, you're going to get treated as well as the country can. End of story. There's nothing else to worry about. And this, for an American, is almost unbelievable. I think there's very little understanding of how these systems work in other countries. And again, the people who say that we can't afford it are not wrong, because already we spend, I think it's something like 20% of our GDP on healthcare, just on Medicare. This is just for people over 65.
20%
for the government spending on people over 65 is like 20% of our entire budget. So trying to include everyone, this is the big phrase on the far left now, becoming the more mainstream left, but Medicare for all is a phrase you will see, meaning this government program is working for people over 65, let's do this for everyone. The thing is, if you expand it at the same price, it's true, we can't afford that. So that's not wrong. On the other hand, the fact is that 20% of our GDP, France spends 20% of their GDP on their healthcare system, covering everyone with the best medical system in the world. It's usually ranked number 1 or number 2. I've lived in France. It's incredible. It's awesome. You don't have to worry about your health. Like you will be covered. And they spend basically the same percent as we do. So the fact that our prices are so high means that we can't afford it, but the other side has a point also, is this works in many other countries. We are still the richest country in the world. There's a way to do better. And it's a really messy situation now because this issue has gotten politicized.
But it sounds like you have an answer to this, like you have a...
There's no easy answer. There's no easy answer. Because, yes, we could try to bring down...
If other countries can do it, why USA cannot do it?
This I believe, that if 50 other countries are able to have universal health care for their citizens, why can't the US do it? And there's 2 reasons.
Yeah. One of these would be probably because it's a business now in States.
Now it's a business. So if you try to cut that business down...
It's a lot of money in the business. So.
It's money. It's about money. And it's about lots of huge companies. Pharmaceutical companies are huge and very powerful. You would have to cut salaries of doctors. Not a lot. Like, by the way, if Americans watching this, there's some news out there that doctors in other countries are basically living below the poverty line because it's a socialized system. It's not true. Doctors in the Czech Republic, in France, in Sweden, they live very well, above average.
Not in Czech Republic.
No, you don't think so? Okay.
Not at all. Not at all.
You think
the doctors in Czech Republic have very low money.
Okay.
And in general, in the hospitals, the people working in the hospitals, they have really low money, so it's getting a big problem to get the people to hospital. In Germany, it's the other side.
Okay.
They have a really high salary.
Okay, fair enough. Also for Americans, every universal healthcare system in other countries is different. France, the UK, Sweden, Czech Republic, Italy, it's different. So yeah, and it's not perfect. But yeah, doctors in France, in Germany, in the UK, they make a very good living, but not as good as American doctors who are doing
Oh,
very
okay.
well. Not as good as for-profit American hospitals, pharmaceutical companies, medical machinery manufacturers, all this. There's so much money going around that you would have to cut that by a lot, and a lot of people would not be happy about it.
Okay.
So there's that. On the other hand, also, we would have to spend more than we currently spend. That's clear. Right now,
Obviously.
half of our expendable or flexible budget goes to the military. So that we would also have to change our priorities of almost certainly moving money from the military to a national healthcare system. And this is also political, and this is also
Yes.
controversial. So it's not easy. So it's easy to say, and I think it's true, if other countries can do it, we can too. That doesn't mean that it will happen, and it doesn't mean that there's actually a way to make it happen. In theory, it's possible. In reality, it's very messy. Very, very messy. And trying to sum all of that up,
Yeah.
it means that
It's possible.
if you're going to America, either for a week or to live there as a student or to work for a year,
Better not get injured.
make sure you have insurance from your home country that will cover you in a reasonable way, so that if you get American medical bills for whatever reason, even if you like fall on the street and break your wrist or something, make sure that you're covered for that, because otherwise it could really suck. So yeah, it's a very sad situation that the richest country in the world has a horrible system. And me as an American, it's in my nature now to not go to the hospital unless I know I have to, because I'm worried about the bills.
I had it. From
Every
many other
American knows this
Americans,
feeling.
yes.
We avoid going to the hospital. We avoid going to get treatment because we're worried that it will be more than we can afford. And this is sad.
You might have a really low rate of going to doctors, but it's not because you don't need them. It's
No.
because you
We
are-
do need it. We need it very much.
Yeah, it's not even because you are not afraid of them. It's afraid of the money you're gonna pay.
Yep. Yep.
Yeah.
This, I think, is heavy on the minds of most Americans. Is what if I get sick? What if I have an accident? What if my kid breaks his leg or something? Or what if I have an accident with some tool and cut off a
You
finger
will
or
send
something?
him to Czech Republic or somewhere else where it's cheap and
Well, yes, but this says something about the American healthcare system, that medical tourism is now a huge thing of mostly Americans going to India, to Thailand, to Bulgaria, to
so even though
to
it's
France.
so far
Yeah.
away, it's gonna
It
still
is-
cost like half of the price or something.
Probably less than that.
Even
It is, if you include the price of the flight, of the stay, of everything, getting a big operation in the US compared to any of these other countries, Portugal or Australia, or Thailand is a big one, India is a big one. They have excellent medical facilities. They have doctors that were trained in the West. They have everything that you need, and it's going to be a fraction of the price. And people have started to realize if they need an operation that's going to cost them $50,000 in the US, it might cost $7,000 or $8,000 somewhere else. So why not take a flight, have the operation, spend a couple
Well,
weeks there?
It depends on the injury, I guess.
It depends.
Yeah.
And the last thing I will say in defense of the American system is that we also still have people from other countries going to the US if they are rich, because for very high level specialists and state of the art equipment, we're number one.
Right.
So if money is not an issue, you can get the best care possible in the US, but you have to have the money, and we're talking about a lot of money.
Okay.
Yeah. So that's a lot of information. What do you think? Does
It's
that
a lot of-
change your impression about the picture that you had, or confirm the picture
Well,
that you
it
had?
confirms that it's bad. After hearing this, I will never go to any other country without insurance, probably. So, if there's one thing I will take from that, it's this, and maybe be more appreciated of the insurance you have in your own country,
Absolutely.
because
Absolutely.
you know where is the worst one.
If you,
Probably the
wherever you
worst.
are, if you can go to a doctor and not have the thought in your mind, oh, I wonder if I will be able to afford this. I wonder if this will be more than I can afford. If you don't have that thought in your head, your country has better healthcare than America. And be thankful for it, because it's not a given.
Just one final comment. In the Czech Republic, we were really angry that we had a new law that said if you go to doctor, you have to pay $1 for a visit, and the people were really, really angry. And it was so unpopular that in few years it was cancelled. So be grateful for what you have. And we'll see you next time after the Caleb is, well, again,